case, it's the secretary. So they're transmitted. We can't control whether a secretary chooses to read them, to disseminate them, and frankly, we get no feedback. We do our part. They are sent in. But where they go from there, what you see in terms of progress is pure tribute to the ex officios who commit their time, who work with the subcommittees, who come to these meetings, and who hear you. But as you say, we send these to the secretary, and so it does raise an open question, but I want people to understand all of these recommendations are transmitted, okay? So don't think we just take these and keep them.
Sure. Can I follow that up? Clearly that's helpful to know. And I guess the question I would have for you, Wanda, because you're very familiar with the process of how to kind of get some outcomes, is it possible for us to, once we've made these transmissions, for us to meet with potentially the secretary, the assistant secretary, and have some discussions with them, with possibly the chair of this committee, so that we can find out, if something is not going to be acted on or is going to be acted on, or how it could be acted on, that we could somehow get some feedback?
Yeah, I think and frankly, this is not a problem that is unique to CFSAC, so I also want to make that clear. There are a number of advisory committees that report to the secretary, some that report to agency heads, et cetera, across this department. The problems wax and wane with how paper is handled. And I would say there's no reason not, and yet, we will have to pursue what's appropriate and how that can be pursued. So
we're going to go Jason, then Rebecca.
Thank you. So just to follow that, I guess as a committee member, I want to express my frustration and concern that for years we've continued to make this one of our lead recommendations, and it appears that we've gotten no results, no response, no comment, no feedback. I think we should continue to make this part of our charge and further this recommendation. It's very frustrating as a committee member for 3.5 years that we haven't gotten any feedback, and we know money's tight, but I do recall at our last meeting we talked about there being stimulus money and it being an opportunity, and I think that we utilized that, or I recall discussing that in our meeting, and yet I think in our recommendation that wasn't part of recommendation number 3, the preamble. We talked about the stimulus. It seems not to have made it into the recommendation. I'm going to urge that we continue to lead that charge. And just for the record, I really want to express concern and frustration about that process and echo what Lenny said about trying to get a voice in front of the ASH or the secretary.
And Jason, just so you're clear, we tried to encapsulate the major sentences from the recs here because we didn't need a 100-page table. Obviously, the recommendation as it stands is in the record. Exhibit
8 of our pamphlet, which is our specific recommendations that were apparently transmitted, it appears not to be in there. So not what you encapsulated, which I appreciate having that chart, but the actual recommendations which are apparently submitted.
I want to go to Rebecca, then Jason.
Chris.
Rebecca?
I believe that this committee should again have a vote of support that this is our #1 recommendation to the Secretary of Health, that these centers of excellence are critical to us, that we see the Whitmore-Peterson Institute. This does not have to be solely a government institution, but we rely on the government because individuals, especially patients, cannot do this themselves. And so I would like to put to vote that we consider this, I make a motion, that the CFSAC consider this our #1 priority in recommendations.
Is there a second for that?
There's a second.
All right, there's a second. Motion is open for discussion. Chris, you wanted to say something. Is it about the motion that's on the floor?
It's potentially relevant.
Okay. Well, all right.
Good enough.
Good
Here
enough.
we go. I assume that some report goes forward about the function of this committee. Somebody suggested the other evening that there's quite a bit of money spent to set up this committee, and we actually cost something. And I feel that the lack of feedback really inhibits our effectiveness. You know, we get no feedback on any of the recommendations we make. We don't know whether they're thought a good idea, whether they're not fundable because they're too expensive, or there are some issues. It would be nice if we got them back and we looked at, for example, if this one's a matter of funding, that's the next problem we address. Say we would love centers of excellence if we could find the funding for them. Then we could put that problem on the agenda and attack that rather than coming back and making the same recommendations over and over again. So if there's an economic argument for running these advisory committees, you know, that presumably we're supposed to be effective, and that would really be helpful, and maybe that goes in a report from your office on the functioning of the committee, if that's a different way to attack the problem.
Yeah, I do want to state that when you read the recommendations, they're different, but they all ask for the same linkage of treatment trial groups and areas of excellence. One of them I know says it gives the money it wants. It says exactly these would be about 1.5 million per year for 5 years. Whether that's changed or not, we could argue about that. But I think we have gone more detailed, and I'll have to say I take responsibility, as I guess all the chairs do. I came down and again met with what I thought was going to be someone who would help move the agenda. That was the Surgeon General. I can state now that what I've learned over the last 3 years is that probably going directly to a high-level person with the Secretary of Health and Human Services would have been a better choice to target. We felt that targeting the Surgeon General was one way of doing it. But I would suggest that although he is in the loop, we would do better for clinical trial groups like this is going to the Secretary Office herself. Len.
I would just like to speak in favor of this motion. I certainly understand that there's mechanisms that we need to work through, as Chris is suggesting, and I encourage us to work those through with Wanda's help and Jim's help. But this particular motion is something that is heartfelt by the patient community, by the research community. It has come up again and again, and there's probably nothing more important than our group feels, and that's why it continues to come up. So even though the wording of it might need to be tweaked, and even though the amounts might need to be determined, I still think it's a spirit of what we're really saying, that we want some response. We want some kind of at least dialogue about the importance of this and whether it can be accomplished and how it might be accomplished. And if it can't be accomplished, we'd like to understand better why it can't.
Yeah. I would say that there's more of an environment now for getting this accomplishment. After all, they put a lot of money out for these challenge grants. And unfortunately, none of us were meeting, and everything is timing. If we could have thought about how we could have stimulated the production of that kind. But we're an advisory panel, not a working group, so that limits us. Jason, did you have another? No?
Call the question, Chris.
Chris?
Lenny referenced how important the centers of excellence would be from the perspective of research community and the patient community. But I think it also would have an impact on education of healthcare professionals if fellows were attending physicians and others, resident physicians fellows, and students would be trained in these centers of excellence. That also would have a great impact for the care of future patients.
Okay. I apologize.
I'm waving now. I would like to voice my support as well for this motion. I think that Centers for Excellence, and we come back to this over and over because it may be the only solution for making progress, and it may be the solution for the frustrations we have also as criticisms have been directed at agencies, because it would provide a healthy competition, and it would really provide interchange, and the Centers for Excellence really would take a step toward actually solving almost every dilemma we discuss in this committee.
Becker?
I just want to add that one of the tools that Centers of Excellence provide that we have not really discussed is in sharing patient data information and clinical trial work that cannot be done because